Imagine a virus. It spreads like wildfire, often unnoticed. It silently infiltrates our respiratory systems. This isn't science fiction. This is the reality of human metapneumovirus, or HMPV. You've probably never heard of it, but it's been quietly circulating among us for decades. This hidden threat deserves our attention. It's time to shed light on this silent epidemic. Discovered in 2001, HMPV is a relatively new virus. It was identified by a team of Dutch scientists who were investigating respiratory illnesses. It belongs to the family, which also includes the respiratory syncytial virus, or RSV. This family of viruses is known for causing respiratory infections. HMPV is a single-stranded RNA virus. This means it replicates quickly within the cells it infects, making it highly contagious. HMPV spreads through respiratory droplets. These are released when an infected person coughs or sneezes, allowing the virus to spread easily. The virus enters the body through the nose or mouth. It then travels to the respiratory tract, where it begins to multiply. Here, it infects the cells lining the airways. This leads to inflammation and the production of mucus, which can cause breathing difficulties. HMPV is a significant cause of respiratory illness worldwide. It affects people of all ages, but young children and the elderly are particularly vulnerable. It causes a wide range of respiratory illnesses. These range from mild colds to severe pneumonia, making it a virus of concern for public health. HMPV can infect anyone. However, some groups are more vulnerable to severe complications. Young children, particularly infants under 6 months old, are at high risk. Their immune systems are still developing. This makes them more susceptible to infections. Older adults are also more vulnerable. Their immune systems weaken with age. People with weakened immune systems are also at increased risk. This includes individuals with HIV, cancer, or organ transplants. Those with chronic respiratory conditions like asthma and COPD are more likely to experience severe HMPV infections. Section 4. Recognizing the enemy. Symptoms of HMPV. HMPV infections often mimic other respiratory illnesses, making it difficult to distinguish from common colds or the flu. This can make diagnosis challenging, as symptoms overlap significantly. Common symptoms include runny nose, cough, sore throat, and fever. These are often accompanied by general feelings of fatigue and discomfort. Some people may experience wheezing, shortness of breath, and chest pain, which can be particularly alarming. In severe cases, HMPV can lead to bronchiolitis, pneumonia, and respiratory failure, requiring urgent medical intervention. These symptoms typically appear within 2 to 5 days after exposure to the virus. The severity of symptoms varies depending on several factors, including the individual's overall health. These factors include the individual's age, overall health, and immune status, which can influence the body's response to the infection. If you or someone you know experiences severe or worsening respiratory symptoms, it's crucial to seek medical attention promptly to prevent complications. Section 5. The Battle Plan. Treatment and Prevention. Currently, there is no specific antiviral treatment for HMPV. This means that doctors and healthcare professionals must focus on other ways to help patients recover. Treatment primarily focuses on relieving symptoms and supporting the body's immune response. This can involve a variety of approaches tailored to the patient's needs. Rest, fluids, and over-the-counter medications can help manage fever and discomfort. These simple measures can make a significant difference in the recovery process. In severe cases, hospitalization may be necessary to provide oxygen therapy and other supportive care. This ensures that patients receive the intensive treatment they need. Preventing HMPV infection involves practicing good hygiene. Simple actions can have a big impact on reducing the spread of the virus. Frequent hand washing with soap and water is crucial. This is one of the most effective ways to prevent infection. If soap and water are unavailable, use an alcohol-based hand sanitizer. This can help kill germs and reduce the risk of infection. Cover your mouth and nose when coughing or sneezing. This simple act can prevent the spread of respiratory droplets. Avoid close contact with sick individuals. Keeping a safe distance can help protect you from getting infected. Currently, there is no vaccine available for HMPV. This highlights the importance of preventive measures. However, researchers are actively working on developing one. This ongoing research brings hope for future prevention. HMPV is a serious respiratory virus. It can cause significant illness, especially in vulnerable populations. It poses a significant threat to global health. Understanding its impact is crucial for global health initiatives. By understanding this hidden threat, we can take proactive steps to protect ourselves and our communities. Awareness and action are key to combating HMPV.